Hello, my name is Bobby Hall. I am a family nurse practitioner student from Jacksonville State. I'm here to do an interview on you. Is that okay?
That's okay.
Okay, what is your full name?
Nicholas Eric Edison Hall.
Okay, what name do you prefer to go by?
Nick.
Okay. Do you have any kind of religious beliefs that might impact your care today?
I don't.
Okay. What brings you to the clinic today?
Just in need of a better nurse practitioner.
Okay. Do you have any kind of issues today?
I've been having a little bit of insomnia, lack of sleep at night.
Okay. Is there anything new in your life that's caused you to have some insomnia?
Just a lot of stress due to the family drama.
Okay. Do you have any allergies? Any kind of
I have seasonal allergies, and I'm also allergic to bee and wasp stings, but other than that, nothing.
Okay, no drug allergies or food allergies. Okay, so what does these things do to you?
It causes the area of the sting to swell up, turn red, and just be extremely painful.
Okay, do you usually treat anything for that?
I buy ice over the area of this thing, and I take Benadryl.
Okay, and that seems to help.
It helps swell
Okay.
it down.
What is your home medication that you take daily?
I take Zantac, I take Claritin, and I do have an inhaler for asthma.
Okay.
I use it if need be.
Okay, and how long have you had asthma?
I've had asthma for about 10 years.
About 10 years. Okay. What about immunizations? Are you up to date?
I'm up to date with my immunizations.
Okay. What about a tetanus shot?
I had a tetanus shot about 7 years ago.
Okay. And flu shots?
About 3 years ago.
Okay. Also, what about past surgeries?
I had tubes put in my ears when I was 2, and then had tonsils taken out when I was 3.
Okay. Any hospitalizations?
I had passed the kidney stone.
Okay. What about mobility? Are you able to get around okay? Do you use a cane or anything like that?
I'm able to get around.
Okay. What about your eyes? Anything different? Like, is your vision getting worse? Anything you've noticed out of the ordinary?
Typically a little worse at night when driving.
Okay. Is that something new?
That is.
Okay. When was the last time you went to the eye doctor?
I went about a year ago, but I haven't had an exam for about 3 years.
Okay. What about medical? Have you had easy access to medical? Have there been any issues with that? Okay. What about dental?
I have good dental, but I haven't been able to go in 10 years.
Okay. What about family history? About your mom and dad?
My mom is 41.
Okay.
She doesn't have any medical issues that I know
Okay.
of. My dad is 42,
Okay.
and he had a heart attack.
Okay. What about your mom's parents, your grandparents?
I'd say my grandmother, she's around 62 or 63.
Okay.
She was diagnosed with AFib and congestive heart failure.
Okay. And what about your grandpa?
My grandfather is probably about 72 or 3 as well. He had blood clots.
Okay. What about siblings? Do you have siblings?
I have 2.
Okay.
One's 22, the other one is 23, 24.
Okay. And any kind of medical issues with them?
The 22-year-old is borderline diabetic.
Okay. What about your dad's mother and father? Are they still living?
They are.
Okay. Any medical issues with them that you know of?
My dad's mother had a heart attack and she had stents put in all 4 valves. And I do not know too much about my dad's father.
Okay. Now I'm going to ask you a couple of personal questions. Are you okay with that? Okay. Are you sexually active? Okay. Do you use tobacco?
I don't.
Okay. What about alcohol?
I do occasionally.
Okay.
Once a month.
Once a month. And during that once a month, how much do you drink?
Probably about a glass full.
Okay. And what do you usually drink?
Vodka.
Okay. What about illicit drugs? Do you use any illicit drugs?
I don't.
Okay. What is your education level?
High school.
Okay. What about, have you ever been in the military?
I have not.
Okay. Have you been out of the country?
I have
Okay. Have you had any thoughts of self-harming
not.
recently?
Not recently, but I have before.
Okay. What about any thoughts of harming others?
I have not.
Okay. Is there anything new in your life that causing you to have these thoughts?
Just stress.
Just stress. Okay. Do you take any medication for it?
I do take Celexa for it.
Okay.
Daily.
Okay. Also, have you had any kind of fever, chills, night sweats?
I do have night sweats.
Night sweats. Okay. Now I'm going to kind of go over kind of review your systems. I'm going to ask you some yes or no questions, and if you answer yes, of course we'll go over them more. Have you had any issues with your ears ringing, any drainage, anything like hurting, anything like that?
I do have an occasional ringing every now and then in my left ear when I start getting my
Okay. What about, have you had any kind of trauma to your head? And you said you have occasional migraines. Is that something new?
It's been for a couple of years.
A couple of years. Okay. Do you take anything prescription or over the counter for it?
I just take over the counter, etc.
Okay. Does that seem to help?
It does help.
Okay. Have you had any kind of redness in your eyes, any drainage, anything like that?
Occasional redness due to allergies.
Due to allergies. Okay. Any kind of sinus pressure around here?
Just do when I have allergies.
Okay. Any kind of nasal drainage? Have you had any kind of problems with bleeding in your nose?
I have had nasal drainage and stuffiness when allergy season starts.
Okay. Have you noticed any kind of different rash or anything on your face? Any more acne or anything like that?
I haven't got any rashes on my face, but I have gotten rashes on the top of my hand that occurs during very warm and hot weather,
Okay.
and I have gotten more acne.
Okay. And have you ever been to a doctor about that?
I have not.
No. Okay. Also, have you noticed any kind of swelling lymph nodes in your neck or in your groin area?
I have not.
No tenderness or anything? Okay. What about any kind of different conditions of your nails or your hair or anything like that?
I have lost the nail on my big toe on my left foot,
Okay.
and it kind of keeps growing back dead.
Okay. Okay. Any problems like chest pain or anything like that?
Occasional muscle soreness.
Okay. On a scale of 0 to 10, what would you rate it?
3 or 4.
Okay. Is that normal? Like, is that something new or?
It only really happens if I overexert myself and just stretch too far a certain way.
Okay. Have you had any kind of stomach issues like nausea, vomiting, any kind of diarrhea, constipation, anything like that?
I would just say nausea and diarrhea, constipation, usually because of my acid reflux flare.
Okay. And does your medication seem to help with that?
It does.
Okay. Also, any problems with your joints? Anything like hurting, pain, anything like that?
Knee pain and back pain.
Knee pain, is that normal or?
I had an accident when I was 11. I got bit by a dog and it cracked my kneecap.
Okay. All right. Is there any kind of medication you take daily for that? Or?
I do not.
Okay. What about, have you noticed any difference with your feet, any kind of rashes or open areas or anything like that?
No.
Okay. Now I'm going to kind of ask you a couple of questions about your mental health. It's kind of like a little mini mental assessment. Can you tell me the year?
It's 2019.
What about the month?
September.
What day is it?
The 23rd.
Okay. And what day of the week is it?
Monday.
Okay. Who is president?
Donald Trump.
Okay. What country do we live in?
United States.
What county?
DeKalb.
What city?
Savannah.
Okay. And what state?
Alabama.
All right. And where are we at now?
Home.
Okay. Also, I'm going to mention 3 objects. I want you to repeat them back to me, and then later on I'll ask you what those 3 objects are, and you'll have to, remember them back to me. First object is apple.
Apple.
Ball.
Ball.
Cat.
Cat.
Okay. Now I'm going to have you count for me from 100 backwards by 5s.
100, 95, 90, 85, 80, 75.
That's good. Also, I'm going to have you spell world backwards.
DLROW.
Okay. Also, I'm going to have you repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. Now, I've got a piece of paper here that has a command on it. I'm going to have you, if you would, do that command. Okay. And it says close your eyes. Also, I'm going to have you write a sentence for me. And it's just to make sure that everything's okay. 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 Also, I'm going to have you draw these shapes for me. Good job. And one last thing. Can you tell me what this is?
Pen.
Okay. And what is this?
Watch.
Okay. All right. Everything looks good. And I thank you for letting me do this interview. Thank you very much.